Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through the end of January 2023. Today, I'm going to go back to something that we did for a little over 2 years, which is what's the current status of COVID-19? And the reason I want to deal with that is we've had a couple of questions about it, but especially because this is the third anniversary of its arrival in the United States. The first reported case was on January 30th, 2020. So it's been 3 years since we've had COVID in our country. It seems like a lot longer than that. So how's it doing globally? Well, you recall we saw these huge spikes in deaths, up to 15,000 a day. But for the last 8 or 10 months, it's been reasonably level with a few fluctuations up and down. And while that looks pretty good, I would remind you that that's still 2,000 deaths a day. It's still one of the 10 leading causes of death worldwide, over 6.5 million officially reported deaths, and probably 2 to 3 times more. The geographic distribution, as you'll recall, early on, it was largely in Europe and then the Americas, and then Europe and the Americas. And then we saw this explosion in Southeast Asia, and then again back to the Americas and Europe, and then more recently an increasing percent from Western Pacific. If you look at those countries that have had the most deaths, the United States leads the pack, at least in terms of countries that are reporting. But if you look at deaths per million, which is really a better measure, the U.S. is still in the top 20. So certainly not doing particularly well compared to other countries. And the distribution, as you can see, is a lot of the Southeast European countries seem to be very high up there for reasons that I don't quite understand. In the United States, we've had this low number of deaths for almost a year now, which is certainly good news, though you don't see it there, but it's actually sort of creeping up a little bit. And perhaps of more concern is hospitalizations, where we do see the last couple of weeks a slight increase. Now, whether it's really coming down or whether that's a delay in reporting, we'll have to wait and see. And of particular concern, of course, is hospitalizations in those over 70. Folks 65 and older remain the highest risk group for dying. But again, the deaths are relatively stable. We've had over 1 million deaths in our country. We're running now between 400 and 500 deaths a day. For much of the last year, it's been in the 300 range, and then about 5,000 admissions a day. If you look at the states where, in terms of total deaths, Tennessee is there at 12. But if you look at deaths per million, and there's Tennessee at 7. And, again, it looks like it's a little bit in the Southwest, Arizona and New Mexico, but then also certainly in the Southeast, Mississippi, Alabama, Arkansas, Tennessee, Kentucky, and so on. According to the New York Times, where cases have been recently, you don't really see much of a pattern other than perhaps a little bit of darkness here in the East and a little bit of strange reporting there, but nothing particular that jumps out at you. Now, one of the questions that has come in, it relates to the new subvariant XB.1.5. I think it's interesting that these viral variants sound more like high-powered weapons than viruses, but this particular variant makes up about half the cases in the United States. And according to the WHO, it's spread to at least 38 countries. Now, this goes back to October, and what you can see here is this is the percent of all reported variants. BA.5 was there, and it's been coming down. 1.1 has been sort of stabilized, but you can see XBB.1.5 has really grown from really just around Thanksgiving to being the most common variant. And over here, you can sort of see the distribution of variants. Geographically, it is interesting also. You'll see that this particular variant is more common in the Northeast and the Mid-Atlantic, less common in the Southeast, and even less common in the upper Midwest, and so on. So the question that always comes up with variants is, does it matter? Should we really be paying attention to these? And in some ways, I think we get distracted by this. Recording the variants is very important, but whether they have an impact on us and the general public, the answer is, well, yes, if. And the ifs are if a new variant spreads more easily. Well, almost by definition, if a variant is taking over, it's spreading more easily than previous variants. So that's probably true for the new variant. If it affects different populations or it spreads differently, and we don't have any information to suggest that this subvariant of Omicron distributes any differently, spreads any differently. If it causes worse or different disease, well, we're relatively new in this, so we don't know. But a recent report from the WHO suggests that it probably doesn't have worse severity. And of course, our death numbers have been relatively stable. So again, probably not more lethal than previous subvariants, or if it is, not dramatically so. But a question that does come up and is important is this new variant or any new variant able to escape pre-existing immunity, whether that immunity is from natural disease or vaccination? A report came out from the CDC yesterday that suggests that the bivalent mRNA booster vaccine does provide additional protection, at least for 3 months. So it's a good news sign. At the same time, an article out of the New England Journal of Medicine that came out again yesterday suggests that bivalent boosters provide substantial additional protection. So again, the best mechanism right now to protect yourself, obviously, is to avoid crowded spaces where you have to breathe other people's exhalations, but really more importantly, vaccinations. This is a chart that I put together. Here is the death rate per million by state. Remember, Tennessee was 7th. And then here's the percent of the population that's completely vaccinated and boosted. So high vaccination rate here, high death rate there. Obviously, high death rate's bad. High vaccination rate is good. And what you can see is there's a very strong relationship. Those states that have the higher vaccination rates have lower death rates. Those states that have the lower vaccination rates have higher death rates. And there's the state of Tennessee there. And this is consistent with what's being reported in the New York Times, where they're saying that unvaccinated folks still are dying at about 5 times the rate of fully vaccinated folks. So again, the data continues to suggest that vaccination and boosting is an important protective mechanism for COVID. So where are we on the 3rd anniversary? Well, we're certainly better off on the 3rd than we were on the 2nd, and better off yet than we were at the 1st. We don't know what the future is going to hold, but I certainly hope that we don't have to be worrying about this at the 4th, though I suspect the data now suggests that we probably need to think of COVID as a chronic disease that will be here for a while, waxing and waning, perhaps like the flu, where some years will be worse than others. And people are even now starting to suggest that we might need to get an annual vaccination against COVID. We'll have to wait and see on that. So that's the update. As always, please feel free to share these videos. We'd like to get as many people watching them as possible. All of our previous videos are available and indexed on the College of Public Health homepage. If you know anyone, or if this has been shared with you and you'd like to be added to our mailing list, please let me know. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And if you have any questions or any topics you'd like to see me cover, obviously I will try to cover COVID about once a month, at least until it's lower than it is now. I'll update us on flu and RSV and other cholera, and other outbreaks. But also I'm going to return to those brief reports on how we can live healthier lives. So if you have any questions or comments on any of those things, please let me know. I look forward to hearing from you. And until next week, please be well.